thank you, Dr. Walters, for a meaningful snapshot of the Mayor's and the Greater London Authority's vision and work toward making London a healthier and safer city for both women and the city's population. I come from the University of Pennsylvania, which is a university in the midst of an urban environment. Penn is located in West Philadelphia, which is a very vibrant urban community. It is multilingual, it is multicultural, there is the largest trans population in the U.S. in the West Philadelphia area, except second only to San Francisco. So it's a very interesting and challenging setting to have to integrate a major university life. The focus on women is critically important, and I really have to acknowledge Dean Afaf Meleis for her work in the area of global women's health, because she really has consolidated the interest in global women's health, and she is known not only at our university but around the world for this very important focus. So I have the great honor of introducing her. You don't often get to introduce your boss in front of an esteemed population, and what I have to say about this wonderful woman who recruited me, and I came to Penn in part because I'm an alum, but I really came to Penn because she called me and she said, "We need you back." And when she says that to you, that's a pretty compelling message. She is indeed a force of nature, for those of you who know her, but she brings to those forces intellect and charm and focus and a passion that makes you want to be more and makes systems want to be more. She is the Margaret Bond Simon Dean of the University of Pennsylvania School of Nursing. She has dedicated her life's work to identifying those unique issues, advocating for women's rights in healthcare, and advancing excellence in women's health around the world. Her scholarship is focused on global health, and among her many distinctions, Dean Meleis serves as the Global Ambassador for the Girl Child Initiative of the International Council of Nurses, and is President Emerita and Counsel General Emerita of the International Council on Women's Health Issues. Her recognition in this field is far beyond how I can explain to you, and you will see in a minute as she speaks to you her passion and commitment to this issue. I do have my own personal agenda also to thank her for appointing me as the director of the Penn Center for Global Women's Health 2 years ago, in July of 2011. This center has as its mission the empowerment of women and promotion of women's health around the globe. And the members, who are an interdisciplinary group of faculty, have stressed three things for the Center for Global Women's Health: advocacy for women, empowerment for women, and innovation to promote women's health. The projects that the Center for Global Women's Health focus on tend to be not direct care delivery, but when global countries and networks reach out to us, we provide the services that they request. For example, when nurse midwives in Guatemala and Honduras wanted to increase their skills, they requested our midwives to go to their countries and look at their curricula and look at their practices and give them counseling on how they could improve it. And in Greece, when they initiated the very first visiting nurse service to provide care to chronically ill children in the home, they requested that home health nurses who have experience in pediatric care go to Greece to work with the home health nurses and encourage them in best practices. So it's a very high honor to be able to show to you, before Dean Meleis speaks, a brief video that discusses some of the work of the center, and then Dean Meleis will take the podium and wow you with her passion and her discussion of global women's health. Thank you very much.
Nurses traditionally have been on the front lines with vulnerable populations.
When no physicians wanted to go into the Appalachian Mountains to provide care, the nurses were on the horses to ride up the mountain. In inner cities, nurses were in the high poverty areas working with people without a safety net. The Center for Global Women's Health is really anchored well in nursing science. Although we have many members who are not nurses, it's an interdisciplinary center. The focus of women in the center is particularly important because women are at the grassroots of health in their communities. The health of families most often is dependent on the mothers of children. The practices of health in the home, all of those efforts are often guided by women. And with economic crises, disasters, times of stress and strain, the health of women and children really are in jeopardy. And so it's very important to have a center to try to begin to reduce some of these very gender-specific difficulties.
The center of Panagia Philanthropini is located in a remote region of a relatively small country. And the people that we serve are often the most neglected populations. Women historically in the rural regions of Greece are faced with challenges when trying to seek systematic screening, especially for breast cancer and cervical cancer, or for children who need systemic screening. The barriers are economic. What we're trying to do essentially is, together with the wonderful Penn faculty, is to bring the knowledge and a piece of Penn here in this little tiny remote area.
This clinic is about empowerment of women and advocacy for women. It's great to be with a group that understands that women are central to the family and to the society here.
We've in particular been concerned about risk-taking behaviors such as violence in the home. The fact that right now the Greek government is not funding pap smears for cervical cancer screening. So we have focused in on those areas that we think can make a difference.
It is really about empowering a community so that they can learn the skills to apply in their own communities to better meet their healthcare needs.
And make it a kind of embassy of love and hope that projects the excellence of scientific knowledge and medicine that Penn represents.
This community has welcomed us to partner with them to provide expertise, but also to help us learn how to work with communities and move health forward.
There's an organization called Midwives for Haiti that is a midwifery education program. Bill McCool and I traveled to Haiti to do mostly educational consultation with Midwives for Haiti to teach teachers how to teach, basically.
And what they wanted to do was study best practices, see what works in developing countries, what is effective teaching in low resource settings.
I have worked in Honduras, Guatemala, the Dominican Republic, and I'd say Haiti is the toughest place I've ever been. Under-resourced, poor, really high maternal and infant mortality rates.
When a mother dies, that's an extremely destabilizing force for the family and then ultimately for the community.
The way to improve maternal infant outcomes is to have a skilled birth attendant at every birth. It's not where you have your baby, it's who's there with you at the time.
Mamie and Bill were instrumental in helping Midwives for Haiti learn about OB simulation. It doesn't take a lot of high-tech instrumentation, which is exciting because you can use the same level of technology at the University of Pennsylvania or in the Central Plateau of Haiti.
The relationships you build with other nurses is pretty significant and can be empowering to those women to feel like they can practice like professionals. And we learn as much from the people in those villages as they learn from us.
When I started doing forensic work, which means that I was spending more time in a jail, which meant that I was in there and with the jail population, and that was an avenue to meet women who'd been trafficked. And then I knew that some people, most people, at least in the Philadelphia area, in the Northeast here, that's how they got involved in prostitution in the first place. They were trafficked.
System-wide, we admit 37,000 people in a year. Of a female population, if prostitution or sex trafficking is a primary charge, that's about 10% of the population. If you think of 100 people here today, You're really talking about, in a year, 500 people, and over 3 years, substantial number of people. And it's not just the individuals, of course, it's their family members that are so significantly affected by that behavior.
For this population, prison is not the answer.
Because we can't do it just from inside the walls. In addition, we have to bring the other social service agency supports around this population. It's not just a physical illness, it's a psychosocial issue.
They're not disposable people. They shouldn't be thrown away. They are people who can get better and healthier and lead productive lives.
Traffickers prey upon that whole us against them mentality. And the youth and the vulnerability and the naivete of a child who's been abused and wants to belong to somebody. And that's the whole horror of it, really, that because they're preying upon someone that's damaged.
Once we've identified the population, then they need a good mental and physical assessment. That has to be first. Then you can get to thinking about things like job training and getting your GED. If you're not healthy, we can't do those things.
So this program could make a great contribution to a lot of individuals and families.
It could make a huge difference. It could make a difference of saving someone's life.
We're recognized as people who roll up their sleeves and walk the walk, not just talk the talk.
And working with women and knowing that we all have this common experience, I do think that that sense of empowerment, taking responsibility for a community of women and families will increase.
I'm proud to direct a center that has as its focus the health of women around the world. We need to empower women and we need to give them a voice. There's no greater calling, and it's a very important focus for a center.
I think now you understand why I called Dr. Lynn Summers and said, it's time for you to come home, Dr. Summers. She is the dynamo behind this center. And I think the point about this center and what you saw now is that the issues that we heard today are global issues. And they are not really they are not bound by any particular city, and therefore we also need to be thinking globally. We need to be collective, because that's the way we're going to make a difference. And I think the other point about this video is also that whatever it is we do has to be congruent with the community that we are working with. So the issues are global. We can learn from each other, and that's what's really happening with all those series of urbanization and cities. What an incredible day. With the energy in this group and in this room have been fantastic. The comments have been so relevant to all of us. And I don't know what else to say, except that I would like to take the opportunity to thank some people. I want to thank people for the extraordinary support that we all got to be here. There is the mayor's office who sponsors this, but my colleague and friend, Dr. Richard Holton. Thank you, Lancet, for being part of this. I think the fact that Lancet is a partner makes this is really powerful and gives voice to the issues that have been here. So thank you very much. You came right on time, and your speech was at the lunch time, was the appropriate time, not in the morning. So I think your biorhythm worked really well with us, Richard. And I want to give my gratitude to all the speakers who have spoken this morning. And Dr. Helen Walters, was really great to see what London is doing. I think we're learning a lot from that, and that's what happened as we take those conferences from one city to the other. We're learning a lot about the best practices and taking them. I do know, for example, that in some places they have created transportation and special cars for women so that they would feel safe when they are going from one place to the other. In Xi'an, China, for example, there are stations everywhere for exercise. You don't have to be paying somewhere to go to a gym. So every city that's really thinking about urbanization and women's health are coming up with some solutions that we can learn from. I do want to thank my colleagues from King's College, London, Florence Nightingale School of Nursing and Midwifery. They have been gracious partners in this. And actually having those partners means they go back and make changes in their own institutions too. So that is by design, because you know something, we all need to own the issues that came up here, and you heard today, and you heard other places. We need to own them, because if we each own them, we're going to each own the solutions too. So it's not for the mayor's office to provide solutions, and it's not for one organization. It's for each and every one of us. Our Liz Kaler and Dean Kaler have been with us. They have supported this conference. He's not here. He's the chair of our board of overseers, but they have been with us right from the beginning. I can thank many people, but there is one person who's behind all that. And this person moved from the United States about a couple of years ago or 3 years ago. And within a month of being here, she said, I want to help. I want to support this. We should have the conference here. We'll have a small conference and a small meeting, and because she has been part of our urbanization and women's health in the United States for the last 5 years. Margie Gordon Shea. Marjorie, thank you so much for a stand up, Marjorie, and be acknowledged. She fostered all what we have done from day one a few years ago, and she continues to do that. She continues to do the outreach and getting support for this, and she hosted this from her heart and her brain, and she got a great group of planners together, and I want to thank them also on behalf of the entire University of Pennsylvania for the work you have done in London. You have helped us not make the mistakes of Americans coming to the United Kingdom and making fools of ourselves here. So you haven't taught us enough about how to speak your language. And if you notice, I do have an accent, a San Francisco accent. So I actually was trained by my British professors way back then, but I lost my accent after being 50 years in the United States. So it takes a group of people to have brought those issues to the forefront and the solutions, and it took Marjorie to be leading that group. But you know, you need somebody else to be staying up all night worrying about the conference from the United States to the United Kingdom. And that person is Wiley Thomas, who is my Vice Dean for Institutional Development. Where are you, Wiley? She's right in the back there. Thank you, Wiley. And I'm gonna now regain my Vice Dean again, who has not had so many sleepless nights over this. So today we talked about issues facing women and girls living in cities, in particular, in cities. So let's see if that works. Okay, living in cities and in the multiplier effect of improving health of women that they would have on the rest of the family. Cities have major two characteristics that I think it might have come in our discussions in different ways. There is the social space, the social capacity, the social capital, and there is the physical capital. So the physical capital of establishing, building the cities and building homes and so forth. But there is also the social capital that's really important, and the social capital tend to foster relationships, safety, because people care about themselves and worry about themselves. The social capital is also about having gardens. It's about the public art. It's about the place where women and children and families get integrated. Professor Liz Kelly this morning talked about the importance of community mobilization to be able to deal with some of the issues. And it is hard to have that community mobilization in a city that's designed without thinking about the social capital, about where are the spaces where you bring people together to be mobilized to work on safety issues, to work on light issues, to work on physical issues, to work on access to health care, to help each other with child care, to help each other with elderly care. So it's really imperative, and that's why we at the School of Nursing at the University of Pennsylvania not only teamed up with our colleagues in medicine and teamed up with social policy and with business, but we also teamed up with the Institute for Urban Research, because it is through the design and the architecture of city that we are going to be able to create those safe environment. And the toilets, let's not forget the toilets too, which are not available. And I have lots of toilet stories to tell you at some point, particularly from Japan and Korea. So the social space, the physical capital and the social capital. The physical capital is creating a city that has places where you can walk in it and you can bike safely in it, and it has access to transportation. But the social capital is extremely important too, which has social designers and architects might have not given enough attention to. Let's see so the question is, what does it take? So we know the issues. We know there are issues with sanitation. We know issues with poverty, and poverty particularly for women. 70% of poor areas anywhere in the world are made up of women. We have more single-family women now, and we have the elderly. Let's not forget the elderly too. As we grow older, we take care of people in our lives, and then people in our life die, and then those elderly women live alone in the city. And of course, in Miami, what we found out is what was really important to them was sidewalks where wheelchairs can go, sidewalks where walkers could be used, and buses that can take the wheelchairs and the walkers. Why particularly women? Well, women do live longer, and they are the caregivers and they are the caretakers, and cities again are not designed for them. So what would it take? What would it take to be able to have healthy women, healthy communities, healthy families, and healthy cities? Well, it takes a global leadership and a global commitment. That is extremely important. And I think Dr. Horton spoke about what's going on in the United Nations. The Ban Ki-moon. He put his money and his energy where his words are. He appointed Michelle Bachelet to head the division of women. And now, of course, she's going back to be the president of Chile. So she takes her agenda to Chile, back to Chile to implement. So it takes a global commitment. He also did something really important. He probably did the latrine days too. That I didn't know. But he did a day, he called it the day for the girl child. It's a girl child that's lost between the babies that we worry about, the mothers with reproductive health, and the adult women. So what's wrong? Why is that important? Well, because we know that girls are trafficked, girls are married earlier, girls become the maids, girls in Africa are taking care of parents, of grandparents, because the parents died because of HIV/AIDS. So the girl child is a lost generation that has not been as much focus on. So it takes a global commitment. That's number one. But it also takes a national and local leadership. It takes a national, and we know that our President Obama has actually dedicated a huge, big budget for maternal health. And I think in your country here, let's see, in your country, there is also a major discussion about trafficking, as we heard this morning, but there is also a report that is for implementation that is more pervasive in society. And I think in the UK, the Home Secretary, Theresa May, aims to toughen legislation on human trafficking. And we heard about also the mayor commitment. But it takes all organizations to do something. Our president, Amy Gutmann, actually got 25 presidents of from universities, teamed up with the United Nations, and the question was, what can each university do to empower women and to end some of the discrimination? Because at the bottom of what we talked about today is the gender divide. And if we don't take care of the gender divide, we are not going to be able to take care of so many of the other issues that have been discussed today. It takes a paradigm shift in every school of medicine and every school of nursing on how we teach the next generation to be thinking about women's health from a life cycle, and as Dr. Horton mentioned, and sustainability, thinking about the future. And I'm sorry to say that the way we educate the future nurses, physician, public health people is still very limited and very siloed, and it's looking at women as reproductive being rather than as women as productive being. So it has to take a paradigm shift, and that paradigm shift comes from an equity and justice perspective. So what would cities look like? Healthy cities. Well, it would have equal opportunity for employment, and we know that because of the gender divide, there isn't equal opportunity. And if I had time, I can give you statistics about how much money do women make as compared to men. It takes to have access to credit and microfinance. It takes access to integrated healthcare. When we asked women in about 6-7 countries, what it is one thing that you would like from the healthcare system, he said, we would like integrated healthcare system. Why do I have to go to so many places to get care for so many different things related to me and the children? And we still don't have that integrated healthcare system. And our morning speaker, Dame Ruth, said, one of the things that are happening in this country is 75 different commissions doing different things. So that's not integrated care. It takes safe environments. In some cities, there is an investment in lights, and companies are actually for advertisement about their company. They invest in one light and they take care of actually servicing that light. So it takes the corporations and the government and the local communities to participate with each other with some very creative solution, creative like this wonderful app about delivery. So there are innovative ways of doing it, but it needs the partnership. It takes access to safe water and sanitation, and the availability of healthy and fresh food, and I think we heard enough about some of these things, and affordable and durable housing. So let's see if I can show here what the city, so advocacy and engagement. So healthy cities, this is what we would want in healthy, walkable streets, and places where you can bicycle safely. And to remind, I think this morning somebody said also that there are more women who die from bicycle accidents than men, even though women are not using the bicycle as much as men. And I think in many cities we go to, even when helmets are required, you will see that the person in the front is wearing a helmet, and usually it's a woman in the back, and she's not wearing a helmet. So it takes some thinking about this. It takes thinking about well-lit streets and ways by which making the street well-lit. And this was also mentioned, yet by 4 o'clock here in London, it gets dark, and women are afraid to go out and walk in their areas. And it takes affordable and accessible transportation. It takes having daycare in the neighborhood, but next to the daycare, also elderly care, because guess who takes care of the elderly in the family until that person dies? It's also the women in the family. It takes having community spaces. In some areas in Philadelphia now, we have great gardens that bring actually the women together to work in the garden, and when they work together in the garden, they talk about access to health care. They talk about who takes the issues related to their children and related to their family. Of course, we want more men to work in the gardens too, but men, when they work in the gardens, they are actually making money because they are gardeners. The women, when they work in the gardens, they are making the vegetables and the fruits for their families. It takes integrated health care, which is exactly what the women are asking for, and it takes having let's see if I have it here. So that's the integrated space, but having also breastfeeding spaces. How many of our organizations have breastfeeding spaces and have breast pumps so the women can get back to being the active, so they can work up to their full capacity? It takes women at the policy table. It's very simple. This is what a city would look like if we have all these things. That's what the community, so there's somebody here who said they are in architecture school. I think take responsibility and see what you could do in building cities and dispelling some of the myth. There is a myth, for example, that cul-de-sacs are wonderful. Well, it found out that some of the research showed that cul-de-sacs actually are not safe place because they are out of sight and there is more burglaries that happen there. And we found another piece of interesting research that women are heavier in cul-de-sacs. They don't tend to walk that much. So there are lots of myths about urban areas that need to be dispelled. And of course, the biggest myth is that urbanization is much better for women. They move away from rural areas and they come to the cities. And it is true. Urbanization provides opportunities for women, provide better education, provide better working opportunities. However, urbanization is also fragmenting to women. It takes them away from the connection. It takes them away from an extended community that support them. And women move to the periphery of the city, and more vulnerable women are living in urban areas without the support. So it does take dispelling some of this myth, and it does take an action but by each individual. If you leave this room, you should leave this room after our last speaker, who's going to really charge us with what we should be doing. You should be leaving saying to yourself, what's the one thing I can myself do? And then what's the one thing that I can collectively do? There is a lot for us to do, and I think I would like to end by saying, thank you, each one of you, for making the time to come here today. Thank you for staying through the day. Thank you for your presence. Thank you for your passion. Thank you for your presence and passion, and I hope that comes out from promoting and empowering women, empowering yourself, and empowering women.